Now, if you're doing 1,000 grafts or more, you're going to have help, right?
Definitely.
You won't really need this.
Not
and you'll be able to draw. The text will draw up their own.
We draw it for Ronan. We just keep them coming until they're...
And no senior techs in Texas?
There may be, like...
Who like me?
Yeah.
Well,
Everybody loves Dr. J.
right.
Or me.
Shut
Even
up.
on Valley.
Everybody, everywhere we go,
hair
they're
to
like,
get just a
you
little.
remove a little bit.
Oh, you know what? I'm good at it.
Yeah, it's bad.
A pencil. We start harvesting by, so like doctor said, we're going to take every other hair. We don't take every hair. You want to kind of envision like a honeycomb shape pattern. So just go in and start where I'm going to harvest the hair. Look at a hair. Place the bevel of the biopsy punch around that. Hold it airtight and just push down and we can split them. We like to leave the hairs intact as much as we can. That way they're not being manipulated.
So as you suck in the saline, it goes into that little collection device?
It does.
And so then you'll put it on the petri dish and like...
And she'll cut into 1s, 2s, and 3s. And the one.
Ideally, like before, when I was harvesting these first couple of grafts, we should only spin in order to break the skin. You're not really drilling down into the scalp.
Dr. J,
I'm right here, man.
oh, hey, Dr. J, did we ever get labs to check my...
For the first night, at least for the first
You
48
want it in the machine?
Yes, there's a little port back here somewhere that it just kind of like pops into place. For all that and post share with you.
So we make them their post-op. We gave them his post-op instructions already from the Neograft. Is that enough?
So the techs will also go over it verbally with them right before they go, just so that they're clear. Usually I like to go over with whoever is picking the patient up, if it's like a wife or whoever's going to be kind of keeping.
What are you going to say?
They may.
Probably a good idea. What about Vistaril or Benadryl?
Yeah,
Knock
because
them out at night.
Hydroxyzine
Like itching.
can still be itchy.
And so if a woman does this, she has to shave the back of her head.
It's
like
all
this
right,
as well.
man.
Because we're giving them...
we can do it
Once you
in
get
layers.
a thing down, it'll all just pop out. You know, next
So
tech
if they
allows
had
you
hair
to...
like
Hold on. No, not staying alive. No way.
No, it wasn't.
Hold up.
collected the grafts. Now I'm going to count and separate them.
Yeah, it was wondering.
Was it painful?
Painless, great.
Once we got all the tumescent anesthesia in, look at him. He's on a boppy, having a great time.
Okay, so what's the difference between neografting and the old technique? So we're gonna have a look at this, and Dana's gonna explain why neografting is better.
The old technique is the FUT, and what they did is they would actually make an incision and take off part of your scalp. Then they would have to close that with this. You can see it's closed here, and you're going to leave with a long linear scar on the back of your head. So even as your hair grows out, you will always have this long linear scar. Versus the Neograft, which is an FUE procedure, which stands for follicular unit extraction. They shave hairs on the back of your head and remove the follicles here. It's non-invasive. You can see this is after the procedure here. When you leave and your hair grows back, there's no linear scar. So it's a less invasive procedure. Minimal downtime is involved as well.
See me for your hair grafting needs.
So as you can see, we remarked his hairline to maybe add a little bit of hair in. We're going to try to make the hairs in slightly different directions. The tech and I, who's been doing this a long time,
7 years.
we've been, let's get started. We care about you because we use before we inject, we use this vibrating, and how awesome is that?
Awesome.
There you go.
It works.
It's the little blade lab one, so it's like a little.
Does that help?
Yeah, I don't even feel you injecting.
So once you have this in, you don't feel this, and I have this vibrating this thing that helps with injections. You don't even feel the injection, right?
Not at all. I don't even feel it.
Just give me his phone number. He gets it. Forming these holes, these slits are pointing this way, so when the hair grows, it grows kind of in a curve and curves backward. And we're mimicking the shape of his hair right now, as you can see here. And this is almost like planting a tree or a plant, like an annual. So we're making the holes and laying seeds. And these hair follicles are seeds.